Hey guys, it's Matt here from EasyRN, and today we're going to be going over concept maps. As you may or may not know, nursing is all about looking at the big picture when it comes to your patients. Early on in school, you'll learn by breaking down typical med-surg diagnoses. As you get closer to graduation, your school will hopefully transition you into looking at each patient as a whole. As you get patients in clinical, you'll find that they'll have many medical diagnoses with an extensive health history. As you start to dig deeper into your patient, you'll find that everything will start to interlink. When you understand the patient as a whole, rather than looking at the pieces, you're then starting to think like a registered nurse. Alright, so let's give you a basic scenario. You have a patient, Mr. Smith, on your unit who is a 75-year-old male admitted for a hypotensive crisis from a nursing home. Upon admission, the patient had a blood pressure of 65/40, elevated BUN creatinine, and was lethargic. The patient has a history of hypertension, diabetes mellitus, dementia, coronary artery disease, arthritis, constipation, and falls. Currently, he has been stabilized and is awaiting discharge. Let's look over the patient and draw up a concept map for this hospital visit. In the center, we're going to put his admitting diagnosis, hypotensive crisis. Around it, we will put all his history and problems, hypertension, diabetes, dementia, CAD, arthritis, constipation, falls. In the ED, his blood pressure was 65/40. Since his BUN and creatinine are elevated, we'll start to think that he's probably dehydrated. On top of that, we have to dig a little bit deeper. Based on his history of hypertension and CAD, we see that he's on metoprolol every morning. This morning, it looks like the nurse at the nursing home gave it to him. According to his chart, his blood pressure upon giving it was 101/55. Since he normally runs hypertensive, the nurse should have probably held the medication. We could see that Mr. Smith was probably dehydrated to begin with. This is common in the elderly, due to their decrease in thirst mechanism. By giving him his metoprolol, the nurse accidentally impacted his blood pressure by dropping it lower. Given his history, we could begin to see a link between everything. I like to tell students to think that everything affects everything. What does this mean? Let's dig a bit deeper. Mr. Smith has a history of falls. What is causing him to fall? Is it because of his dementia? And he's confused trying to get out of bed in the middle of the night? Possibly. What else could cause him to fall? Well, he came in for a hypotensive crisis. Is this something that happens frequently? Does his low blood pressure cause him to become fatigued and fall? His dehydration could be caused from simply not drinking enough water, which he forgets to do because of his dementia. What about his arthritis? He could have been having pain with range of motion, and that could contribute to his falling. Or he could be taking narcotics for his arthritis, which could also contribute. Narcotics could also make Mr. Smith constipated. Constipation could also be caused by being dehydrated. Not being able to defecate would make the patient feel like he constantly has to go. This leads to frequent trips to the bathroom, which could lead to a fall. I also mentioned that he's diabetic. Are his sugars too high or too low and affecting his mental status? Diabetes is a huge risk factor for coronary artery disease. What medications is he on for this? Could he be taking nitrates? What about the metoprolol, the beta blocker for his heart? These medications could cause dizziness, lightheadedness, and contribute to a fall. This is just a fraction of the list of things I could add to this concept map. As you can see, everything affects everything. Now you may be asking, how do I make a concept map? There is no right or wrong way to make a concept map. Each school and every book you read will have a different way to go about it. No one way is better than any other. The point of the concept map is just to draw connections. If you're creating a concept map for a class assignment, please follow the guidelines provided by your instructor. To start, put your patient in the center. If this is your patient from clinical, make the center state their admitting diagnosis. In the bubbles or boxes around it, you could put their health history. Under each item, you can list vital signs, medication, lab values, and any assessment findings that you currently have about the patient. You may put the same findings in more than one bubble if it pertains. For example, Mr. Smith takes metoprolol for his coronary artery disease as well as his hypertension, so you can list it under both. From there, begin to list nursing diagnoses for each area. If you do not know how to write the proper nursing diagnosis, please see our other video on nursing diagnoses. Once all of that is listed, you can begin to make the connections. For example, hypertension leads to coronary artery disease, which leads to fall. Remember, everything affects everything. You could basically draw an arrow from one thing to the next, to the next, to the next. It keeps going and going and going. Your skills on making concept maps will evolve over time. By learning and through your experience, you will begin to make the connections. As a student, you will be limited as you are still at the beginning stages of your nursing career. As you gain more and more nursing experience and knowledge, it will become second nature, and you will see the patient as a whole. When they say think like a nurse, this is what they're talking about. Thinking the patient as a whole.